it's really a great masquerader, and it can hit anybody.
Yeah. Don't forget the phone number to text your questions for our guest, Dr. Keating, is 407-490-3075. Again, 407-490-3075. Dr. Keating, there are some children who are in the hospital for something other than COVID and happen to test positive for the virus. How are those cases handled? Are a lot of children with the virus asymptomatic?
The large majority are, Tom, and that's, again, the other wild card about the disease, because we don't know who's a carrier because the majority of children are symptom-free. Historically in our hospital, the large majority of kids that were COVID positive were found almost incidentally in the course of evaluating them for other conditions. I come in with an appendicitis, I get a test, oh, you're positive. Nowadays, unfortunately, the large majority of kids in our children in our hospital have COVID disease, COVID pneumonia. However, if the COVID is found incidentally in the course of evaluating for another problem, we would change perhaps our sequencing and the PPE coverage and maybe move a child to a room if need be and watch them a bit more closely, obviously. But we treat every child with care and precautions.
Most schools, as you know, started back this week in Central Florida. Local districts encouraging children and teachers to wear masks. Why are these as important as ever, if not perhaps more right now?
Well, my message is the same as it was 18 months ago. Things haven't changed. If anything, Tom, things have gotten worse. Now, you know, the paradox is at the end of the school year last year, about 80% of the children in Central Florida were in real school. We had blunted the surge of one of the COVID waves, and we did the right things. We masked, we socially distanced when we could, we washed our hands. Nothing's changed. In fact, if anything, this COVID is more significant and more potentially dangerous to our children. So, and kids have adapted, and I can't understand why they aren't adapting again to this year. So when kids come to my office, I say, look, this is your daily hygiene. You brush your teeth, you comb your hair, you put on your mask. And they get it. I don't get any pushback. I would strongly encourage everybody to at least mask your children and give them that lesson.
If most children only develop mild symptoms from COVID-19, if any symptoms at all, why is it important to take these preventive measures in school or other public places?
Well, I guess I would respond to that as, why take the chance? You know, if I have a 1 in so many thousand chance of getting really sick, that may not be a chance I want to take. And in addition, if a child goes to school and comes back symptom-free and infects a parent who's not been vaccinated or a grandparent who has a pre-existing condition, you've got yourself a lot of trouble that could have been avoided. And I think that's the tragedy, Tom. A lot of this could have been avoided by better vaccination and will be blunted by better masking and vaccinating when age able.
We have a question from the media here. This comes from Amanda Castro with WKMG. Are you anticipating an increase in COVID pediatric cases and hospitalizations now that school has started? And we talked a little bit about her second question, what can be done to prevent this?
I hope not. I'm very concerned, and I think the other pediatric providers in our community are concerned as well. But again, we've had asymptomatic children in schools who have done well, and we've done well in the community if they mask. And I understand about the importance of getting back to school. Virtual school is tough for many children. That said, if you're going to go to school, wear a mask so we can not have the kind of numbers that are potentially continuing to evolve as were discussed here earlier today, Tom.
Many families are ready to move beyond COVID. I mean, I think a lot of us are, you know, our physicians, nurses, caregivers. What's the best way for all of us to get out of this?
Well, there's two ways. The easy way is to get vaccinated, and the hard way is to get the COVID disease and get immunity that way. I know which one I'm going to pick, and perhaps you can comment in that regard. I think it's interesting for children. I was telling one of the patients, I said, they knew the Where's Waldo game, right? Where the little guy's peeking in among all the other people. We want COVID to be the little Waldos. So few of them that you can't hardly find them, and everybody else is vaccinated. So I guess the choice comes down to, do you want to be one of the healthy people who's vaccinated, or do you want to be a Waldo? I know where I want to be.
And to your point, to let everyone in, I recently had COVID. I was not hospitalized, but it was close. And I can tell you, if I had the choice to do it all over again, it would be the way you're choosing as well. I will say that to
From the
answer your
horse's mouth.
question.
I'm glad you're better, Tom.
Thank you. So, what do you say to parents who are worried about side effects from the vaccine? Does it make sense to you that people are worried about surprise side effects from the shot, perhaps 5 or 10 years from now?
Long-term consequences from the vaccinations would be almost unheard of because the vaccination's almost immediately degraded once it enters into the cytoplasm of the cell. When I get questions like that, I ask them, I say, have you ever had mumps? No. Have you ever had chicken pox? No. Have you ever had polio? No. You know why? Because when you were a child, they lined you up and they gave you those vaccinations. And I talk about the potential downsides of the vaccinations, but the benefits of the vaccinations far, far outweigh the risks. So your chance of getting a serious consequence from a vaccination is about 1 in 10,000. It's much more dangerous to put your child in a car and drive them somewhere.
We have a question for you from a Facebook viewer. Do you recommend the vaccine for children 12 and up who have food or medication anaphylaxis?
It's a very good question, and people should know that the side effects in the vaccinations are not from the actual vaccination itself, i.e. the contents, but from the vehicle that it's used to give the injection. So there are certain sugars, for example, that might be in the vaccination that might cross over with certain food groups. So this should be addressed with your provider to see if there's a crossover, but it's extremely uncommon. If you've had a side effect from the first shot, that's something I think that has to be discussed as to whether you'd be a candidate for a second.
We have another question from the media. This is again from Amanda Castro at WKMG. How much more dangerous is the Delta variant for children, and any concerns for other variants that are out there, such as Delta Plus or Lambda?
Whoa, that's, well, you've opened up Pandora's box, but it's an important question. So let's draw the history of COVID. Alpha variant came to the herd, our herd, picked off the old people, picked off the ones with pre-existing conditions. We didn't have vaccinations. The middle group looked at that experience and they followed accordingly. Many, I don't need the vaccination, I'm okay, I'm bulletproof, I'm not going to get sick, right? The Delta variant came in. Guess what happened? This hospital is filled with patients, over 90% of whom have never been vaccinated. Well, guess what? If we get a third generation and it's more aggressive, because that's what viruses tend to do, who's most at risk now? The children. Yes, get your child vaccinated when age appropriate, and let's hope that the vaccinations for the younger children is on the near horizon, Tom, and I think it will be.
You mentioned age appropriate. Do we have any idea yet when the shot might be available for children younger than 12?
It's not been solidified, but we're looking hopefully towards the end of the year. I pray for that. That's what we need, Tom. And when it comes, get your child vaccinated.
What is one of the hardest things you've heard from a patient or family member during this pandemic?
Well, first of all, Tom, I think that COVID has been the biggest tragedy in my lifetime, and like all of us, I've had a few, and that of our countries. And, you know, it's nothing sadder than to watch the news and see some fellow that's there on his deathbed imploring his family to please get vaccinated. I wish I could have. That said, you know, I come in every day and I see these people working dutifully hard for the common good. These are the real heroes, the nursing staff, the respiratory people, the people that clean the rooms, the pharmacy staff. And then when I look at the news as well and I see another group of people that tend to disregard those efforts and underscore how significant that is, that I think that's really, really hard on me. And I think if people want to do the right thing, go out, get vaccinated, mask your child. That's what Americans do. They do what's good for the whole. Let's stop thinking a little bit less about ourselves and whatever beliefs we might have, and think about what's best for the whole. And that's what's best for the whole, Tom, without doubt.
I have another question from a Facebook viewer. Is prior infection as good as the vaccine, and isn't vaccination still recommended after COVID infection?
Prior infection does give you some immunity, but you can get an additional boost You wait about 30, 35 days, and you can get the vaccination and get a supplemental boost. So don't rely on the fact that you've been infected. Go ahead and get the vaccination. It's very safe, and the more armor I can put on when I'm doing battle, Tom, I'm going to put it on.
Dr. Keating, it is always enlightening, always a pleasure to talk with you. Thank you very much for being here today with us.
Thanks for having us, Tom.
And we will be back next Thursday morning with more COVID-19 updates on the AdventHealth Morning Briefing. Until then, stay healthy and feel whole.